Hello, everyone. Welcome back to OB Clarity with Dr. Godfrey, PhD RN, the podcast for nursing students who want to pass OB with less stress and more confidence. I'm Dr. Godfrey, and today we're talking about OB exam secrets. That's right, what your professor really wants you to know. Have you ever walked out of an exam wondering, why in the world did my professor even ask that question? If you felt blindsided, this episode is for you. So, why do exams feel so tricky? I don't even like to say the word, but I'm going to say it. Why exams feel so tricky? Here's the truth. Your professors aren't just testing facts. They want to know if you can think like a nurse, but we need to help you to do that. I have a hard time when people say that to nursing students. You need to think like a nurse. Well, have you helped the student to learn how? So there's one thing. So it's not enough to memorize PowerPoints, guys. The real test is, can you keep patients safe? Okay? So instead of asking, what is preeclampsia? You'll see questions such as, which patient should the nurse see first? That's the shift from definitions to decision making. Besides, that's what you're going to be doing as a nurse. So, what your professor is really testing? Most OB exam questions boil down to three things. Are you ready? Number one, do you know your priorities? Airway, breathing, circulation, safety, right? Number two, can you spot the red flags? So in this instance with preeclampsia, can you spot severe headache, high blood pressure? Number three, can you apply it to practice? Not just what you know, but what you do. That's the difference. So let's go through an example. We have a 32-week pregnant client arrives at the emergency department with painless vaginal bleeding. Now, which action should the nurse take first? A, perform a vaginal exam. B, call the ultrasound technician. C, apply external fetal monitoring. D, start an IV line with normal saline. Okay, let's walk through it. Let's reason this through. Do we want to do a vaginal exam? Please, no. Why not? Because it can cause more bleeding. If the placenta is covering the cervix, that's what a placenta previa is, right? You don't want to do a vaginal exam. How about an ultrasound? Not yet. That's diagnostic, but it's not immediate safety. How about putting that fetal monitoring on first? Well, that's important, right? But if mom is unstable, the baby's going to be unstable too. So how about starting that IV line with normal saline? Ding, ding, ding. IV line with fluids, yes, that's the first priority. You're going to stabilize mom because keeping her safe is the fastest way to keep baby safe. Once that IV is running, you can put on that monitor and do everything else. So this is exactly what professors want to see. Safety first, then assessment. Let's keep them safe, okay? So here's some quick exam tips. When you're taking your next OB exam, here are three quick strategies. Number one, anytime you see words like first, priority, best, take a pause. Those are your signals. And then ask yourself, number two, what keeps this patient safest right now? And then number three, picture yourself in the patient's room. I say that to my students all the time. Imagine you are there. What's the very first thing you would do before anything else? If you are saving that patient, you're going to do that first. Okay? All right. So in closing, here's the secret. Your professors don't want you to just memorize facts. Do you need that understanding and recall? Absolutely. When we talk about Bloom's taxonomy, that is important. But the instructors want to see if you can prioritize, if you can recognize danger, and if you can protect that mom and baby. That's what we want. So if this episode gave you clarity, share it with a classmate who's stressing over their next OB exam. And don't forget to subscribe so you never miss an episode. So until next time, remember, always assess, don't guess.